ആരോഗ്യ വിവരങ്ങൾ ഉൾക്കൊള്ളിച്ചുകൊണ്ട് US വീക്ക്ലി റൗണ്ടപ്പിൽ ഇനി ലൈഫ് ആൻഡ് ഹെൽത്ത്.
Hello everyone, I'm Dr. Rose Vadakara and welcome to Life and Health. In today's session of Life and Health, we are going to discuss the most common type of irregular heartbeat, which is known as atrial fibrillation. And to discuss this cardiology topic, we have Dr. Sandeep Nathan. He is an interventional cardiologist in University of Chicago with more than 20 years of experience. Welcome, Dr. Sandeep Nathan, to Life and Health.
Rose, thank you so much for having me. It's a pleasure to be with you.
Dr. Sandeep, so what actually happens to your heart when you have an AFib?
So atrial fibrillation is the most common heart rhythm abnormality in the world. In the United States alone, it's estimated that perhaps as many as 6 million patients have atrial fibrillation. Essentially, it's sort of an electrical dysregulation of the top two chambers of the heart, or the atria. Normally, a cluster of cells called the pacemaker cells in the atria sort of set the tone for the entire heart in terms of the electrical rhythm. Impulses travel down from the atria to the ventricle, capture the ventricles, and the heart pumps, and that process is repeated 60 to 100 times per minute normally. In atrial fibrillation, the top chambers of the heart have sort of gone electrically haywire, and they're firing in a dysregulated or uncoordinated fashion. Often this causes the heart to speed up, and patients don't feel very well with uncontrolled atrial fibrillation.
You didn't mention that atrial fibrillation is a very common heart condition. Who all are at risk for AFib?
Well, there's a lot of different patient populations that are at risk for atrial fibrillation. I would say that the number one risk factor is really heart disease and age, and often these two accompany one another. So congestive heart failure or weakening of the heart muscle can predispose you to atrial fibrillation. But even if you have strong heart muscle function, as you age, the risk of electrical degeneration increases. There are other more minor factors. Obesity increases it, hypertension increases it. Diabetes, to a modest degree, can increase the risk of atrial fibrillation as well. Lung disease can increase the risk of atrial fibrillation, and then blockages in the blood vessels that feed the heart all sort of contribute to the process.
So if a patient have AFib, do you think that the patient can feel the symptoms of AFib?
Patients with atrial fibrillation, many of them will feel palpitations as their heart rate suddenly speeds up and becomes quite irregular. It's an unpleasant sensation of your heart fluttering, or perhaps some people say that it feels like they're having shortness of breath or butterflies in their chest. Others will not feel anything at all, and that's where atrial fibrillation can be quite dangerous, because it can persist for weeks, months, or even longer, years, and remain largely undetected unless a physician either diagnoses an irregular heart rhythm or does an electrocardiogram.
Dr. Sandeep, let's discuss further more about these diagnostic measures. You did mention about the electrocardiogram. What are the diagnostic tools are utilized to diagnose arrhythmias?
Atrial fibrillation impacts outcomes for patients in a variety of different ways. We can diagnose it first and foremost by simply doing an electrocardiogram or EKG in a physician's office, and that will often pick it up. There are more sophisticated wearable devices, either short-term monitors or long-term implantable monitors, if atrial fibrillation is suspected, but it's been difficult to pick it up on any single ECG. As you know, an ECG or an EKG only picks up about 10 seconds worth of electrical activity. It's just a moment in time. But if the atrial fibrillation is coming and going, it may be a little bit challenging to diagnose it. And there are a number of wearables and implantable devices that will help you diagnose it. Interestingly, although not a medical device, the Apple Watch actually has an atrial fibrillation detection algorithm built into it. It's by no means medical grade and does not have FDA approval for making therapeutic decisions regarding atrial fibrillation, but it may be an early warning monitor that many patients can avail themselves of.
Even though Apple Watch is not FDA approved, it is good to know that this watch has this feature to identify heart rhythms. Now, how do we treat atrial fibrillation?
Atrial fibrillation treatment can be divided into two different compartments. One is rate control and the other one is rhythm control. The third compartment is thinning out the blood with oral blood thinners to reduce the risk of stroke. The big feared complication of atrial fibrillation is stroke, and this can happen because the upper chambers of the heart, when they're uncoordinated, dysregulated, they don't pump effectively, and so blood can pool in one area or the other of the atria, form blood clots, and if a piece of that blood clot breaks off and goes to the brain, well, that's what we refer to as a stroke. And so thinning out the blood in atrial fibrillation helps reduce the risk of a stroke while you're still in atrial fibrillation. The other two compartments that I mentioned are rate control and rhythm control. Ideally, you'd like to get back into a normal sinus rhythm and get out of atrial fibrillation. There's a variety of pharmacologic and device-based therapies, procedural therapies for getting patients out of atrial fibrillation. But if those have failed, then the second choice is rate control, where at least the heart isn't racing all the time. That will ultimately have a negative impact on heart function. And there are medications to help regulate the rate.
Before we close today's session, doctor, one last question. Why patients with atrial fibrillation has a greater risk of developing stroke than those who do not have an AFib?
Yeah, the risk of the lifetime risk of stroke with atrial fibrillation not treated with anticoagulants or blood thinners is extremely high. I think the viewers should know that stroke associated with atrial fibrillation is more likely to be fatal and more likely to result in lifelong disability than other forms of stroke, perhaps associated with diabetes or disease of the carotid artery and so forth. So it is something that should be top of mind for anybody treating atrial fibrillation or any patients with atrial fibrillation.
Atrial fibrillation പറ്റി നൽകിയ വിവരങ്ങൾ ഏവർക്കും ഉപകാരപ്പെട്ടെന്ന് പ്രതീക്ഷിക്കുന്നു. വീണ്ടും കാണാം അടുത്തയാഴ്ച മറ്റൊരു വിഷയവുമായി. Thank you, Dr. Sandeep, for your time with us on Life and Health.
Thank you for having me. It was a pleasure.
US വീക്ക്ലി റൗണ്ടപ്പിന്റെ ഈ എപ്പിസോഡ് ഇവിടെ പൂർത്തിയാകുന്നു. നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും ദയവായി ഏഷ്യനെറ്റ് US വീക്ക്ലി റൗണ്ടപ്പ് എന്ന ഫേസ്ബുക്ക് പേജിലൂടെയോ asianetusnews@gmail.com എന്ന ഇമെയിലിലൂടെയോ 7324299529 എന്ന വാട്സപ്പ് നമ്പറിലൂടെയോ ഞങ്ങളെ അറിയിക്കുക. മറ്റൊരു വൈവിധ്യമാർന്ന എപ്പിസോഡുമായി വീണ്ടും കാണാം അടുത്തയാഴ്ച. നന്ദി, നമസ്കാരം.
Citywide Mortgage of America Corp., mortgage experts serving Illinois, Florida, and California. Committed to provide high-quality home loans, lowest mortgage rates in the market. Specialized services for first-time home buyers, conventional, FHA, VA loans, and jumbo loans. Refinance and cash-out refinance. Home loan experts dedicated to making sure your home purchase or refinance experience is top-notch. We deliver what we promise. Visit www.citywidema.com.
Namaskaram. Attorney Steve Griffiths here. Greetings to the Malayali community and blessings during these challenging times. We understand the unique character of the Kerala community, and we are here to serve your legal needs for all injuries, accident, and wrongful death cases. Call us when you need help. All consultations are confidential. Namaste.